Good morning. Happy Wednesday. Welcome to chapter 25. Yesterday, you started your exam on Tuesday, the end of the radiology section, chapter 24. You have until Sunday to complete that exam. Remember, late turn-ins will reduce your credit. Points will be deducted if you turn in your exam after Sunday. Remember to check your emails in its entirety. Check your news and announcements daily when you log on and when you log off for the evening. Please remember, if you have any questions or concerns, please feel free to give me a call, text, or email. My office hours are Monday through Thursday, 8 a.m. to 5 p.m. On Friday, 8 a.m. to 4 p.m. I am off on weekends. Please do not contact me via text or call. You can email me and I will return all correspondence on the next business day. We do not have class on Tuesday in observation of Mardi Gras. There is no class on Tuesday in observation for Mardi Gras. Please make sure that you're reading and watching your videos. Make sure that you're reading your PowerPoint slides, very important information. So I'm going to share my screen. We're going to go ahead and get started with this 5-minute video. So what we're going to go over right now is chapter 25. Chapter 25, Pathology and Laboratory. So the objectives that are going to be covered in this chapter that we will go over today explain the format of the Pathology and Laboratory section, understand the information in the Pathology and Laboratory guidelines, demonstrate an understanding of pathology and laboratory terminology, differentiate amongst the organ or disease-oriented panel codes, recognize drug assay codes, identify therapeutic drug assay codes, classify evocative suppression testing codes, explain pathology clinical consultation codes, interpret urinalysis, molecular pathology and chemistry codes, evaluate hematology and coagulation codes, describe immunology codes, discriminate amongst transfusion medicine codes, interpret microbiology codes, evaluate anatomic pathology codes, summarize cytopathology and cytogenic study codes, explain surgical pathology codes, choose other procedure codes, demonstrate the ability to code pathology and laboratory services. So this is what's going to be covered in this chapter, Pathology and Laboratory. What we're going to cover today for our 5-minute video that's going to be in your daily assignment is explaining the format of the Pathology and Laboratory section and understanding the information in the Pathology and Laboratory guidelines. So right here it states, this is in your step-by-step medical coding, Pathology Laboratory, page 643. Format. The Pathology and Laboratory section of the CPT manual is formatted according to type of test performed. I'm going to read that again. This is the format. The Pathology and Laboratory section of the CPT manual is formatted according to type of test performed. Automated multi-channel panels, assays, and so forth. To familiarize yourself with the content of the Pathology and Laboratory section, review the subsections in the CPT manual. This will help you get to a broad overview of the contents of this important section as you prepare to learn the specifics. Laboratories have built-in indicators that allow additional tests to be performed without a written order from the physician. These standards are set by the medical facility and imply that when a certain test is positive, it is assumed that the physician would want further information on the condition and specific additional tests performed. For example, if a routine urinalysis is performed, a culture is performed if the test is positive for bacteria. If a culture is performed to identify the organism, a sensitivity test is performed if the bacteria are of a certain type or count as predetermined by the medical facility to warrant the additional laboratory studies. You will code only after the tests are performed, because in order for a laboratory test does not ensure that the test will be performed. So it's letting you know there, just because they ordered that test doesn't necessarily mean that they're going to go ahead and provide that testing. This standard ensures that all laboratory tests performed are reported. Remember that what the physician ordered may not be all the laboratory work performed, depending on the facility's policy concerning the indicators. The services in the pathology and laboratory section include the laboratory test only. Highlight this if you can. The services in the pathology and laboratory section include the laboratory test only. The collection of the specimen is reported separately from the analysis of the test. For example, if a technician in a clinic laboratory withdraws blood by means of a venipuncture from the arm and the blood sample was then analyzed in the laboratory, you would report 36415 for the venipuncture as shown in figure 25.1. Here's the figure 25.1 venipuncture. In addition to a code to report the test performed on the blood in the laboratory. Most pathology and laboratory subsections contain notes. Whenever notes are available, be sure to read them before assigning codes from the subsection, because specific information pertinent to the code is contained in these notes. So whenever you go in the pathology and laboratory subsections, read your notes before you start to code. So right here, I'm going to share and show you the PowerPoint slides. So types of pathology and laboratory, subsections such as organ or disease-oriented panels, drug assay, therapeutic drug assays, evocative suppression testing, consultations, clinical pathology, urinalysis, molecular pathology, chemistry, hematology and coagulation, immunology. We went over these things in the first part of the lesson. Transfusion medicine, microbiology, anatomic pathology, cytopathology, cytogenic studies, surgical pathology, transcutaneous procedures, other procedures, and reproductive medicine procedures. So this information is in your PowerPoint slide. So it's very important to review your PowerPoint slides. And underneath here, it states, the pathology and laboratory section of the CPT manual is formatted according to types of tests performed. Here it is again. The pathology and laboratory section of the CPT manual is formatted according to types of tests performed. So this is how it's formatted. Next, pathology and laboratory, where here is that diagram again for figure 25.1. Codes for laboratory tests only. Specimen collection is coded separately. Example, venous blood draw reported 36415, surgery section. Specimen collection is coded separately. In the pathology and laboratory section, codes for laboratory tests only. Medicare fee schedule each year identifies those lab tests associated with a physician component modifier 26. Remember that session when you had about the modifier. And it states here, the services in the pathology and laboratory section include the laboratory test only. The collection of the specimen is coded separately from the analysis of the test. So make sure that you're reading that information and is explaining to you how you code separately. Facility indicators allow additional tests without physician written order. Example, urinalysis positive for bacteria, built-in indicator for culture. So this is a facility indicator. It allows additional tests without physician written order. And here is an example. At the bottom, it states, laboratories have built-in indicators that allow additional tests to be performed without a written order from the physician. These standards are set by the medical facility. These are set by the medical facility. Indicators imply that if a test is found positive, it is assumed that the physician wants more information on the condition. If a routine urinalysis is performed, a culture is performed if the test is positive for bacteria. So these are the objectives for the introduction of pathology and laboratory. Please make sure that you read your PowerPoint slides. This chapter is pretty long. It's 6 days. So please make sure that you're looking and you're reading your medical terminology, you're reading your PowerPoint slides, you're reading through the chapter to answer those exercises. So thank you. Enjoy your Wednesday. Remember, we have class, Zoom class for 4 p.m. on Thursday. Every Thursday, we have our Zoom class for 4 p.m. So I'm looking forward to more students joining our Zoom class. This is how you would get your extra points. So please remember to join our Zoom class every Thursday, 4 p.m. NCCT prep class is every Tuesday for 2 p.m. Thank you. Enjoy your day. Bye-bye.